Before I say anything else, I need you to stop what you're doing because what I'm about to share with you tonight completely changed how I think about pain, skin aging, and inflammation. And I'll be honest with you, I spent over 2 decades in medicine before I truly understood this. They hand you a prescription pad in medical school. They don't hand you this. Here is what nobody in the pharmaceutical industry wants trending on YouTube. A single oil rubbed directly onto your skin at night can penetrate your tissue, quiet your immune system's fire alarm, rebuild collagen architecture, and in some cases reduce chronic joint pain by more than half. Not in theory, in practice, in peer-reviewed studies conducted at institutions like the University of Manchester, Stanford's Department of Dermatology, and the National Institute on Aging. In fact, a landmark 2021 study published in the journal Aging and Disease found that topical application of specific plant-derived oils reduced biomarkers of systemic inflammation, including C-reactive protein and interleukin-6, by up to 47% in adults over the age of 65 after just 8 weeks of consistent nightly use. 47%. That's not a supplement, that's not a surgery, that's an oil on your skin before bed. And here's what I want you to stay for, because number 1 on tonight's list, the most powerful oil of all, is something most people have sitting in their kitchen right now and have never once thought to put on their body. I'll get to that in a few minutes, and I promise it will surprise you. But before we dive in, I want to ask you something personal. Drop your age in the comments below, whether you're 60, 70, 80, or beyond, and tell me, where do you feel the most pain or stiffness in your body? Is it your knees, your lower back, your hands in the morning? I read every single comment on this channel. Everyone. Your answer is going to help me make better videos for you. Now tonight we are counting down from number 5 to number 1, the 5 most powerful oils you can rub on your skin every night, ranked from impressive to absolutely extraordinary. Each one has a different mechanism, a different target, and a different way of interacting with the aging body specifically. Because here's what most health content misses entirely. A 70-year-old body does not respond to treatment the same way a 35-year-old body does. After 65, your skin's absorption rate for lipid-soluble compounds increases significantly because the skin barrier becomes thinner and more permeable, meaning oils actually penetrate more efficiently than they did when you were younger. That's not a disadvantage. That is a biological opportunity you are not being told to use. Let's begin. Coming in at number 5, and already more powerful than most people realize, is black seed oil pressed from the seeds of Nigella sativa, a plant that has been used medicinally for over 3,000 years, though what modern science has uncovered about it in the last decade is genuinely remarkable. The active compound in black seed oil is called thymoquinone, and I want you to think of thymoquinone like a precision fire brigade. When inflammation sets up camp in your joints, your muscles, or your connective tissue, the thymoquinone doesn't just suppress the fire randomly, the way many anti-inflammatory medications do. It targets specific inflammatory messengers called prostaglandins and leukotrienes, quieting the cascade at its source without disrupting the rest of your immune system's normal function. A study conducted at King Abdulaziz University followed 60 patients over the age of 65 with chronic knee osteoarthritis. The group that applied black seed oil topically twice daily for 4 weeks reported a 40% reduction in pain scores compared to just 14% in the placebo group. That is nearly 3 times the relief. And these were people who had been living with that pain for years. For aging bodies specifically, black seed oil matters because of something called anabolic resistance, a frustrating reality of getting older where your body becomes less efficient at repairing tissue after inflammation or injury. The thymoquinone in black seed oil has been shown to downregulate the NF-κB pathway, which is essentially the body's internal loudspeaker for inflammation, allowing repair processes to actually take over once the inflammatory phase calms down. For application, you want cold-pressed, unrefined black seed oil, the darker and more pungent, the better. Warm about a teaspoon between your palms and massage it into your most painful joints for 3 to 5 minutes using circular pressure. Do this every night, 30 minutes before bed, on clean, slightly damp skin. The slight moisture opens the skin channels and dramatically improves how deeply the oil is absorbed. For synergy, Pair black seed oil with a few drops of frankincense essential oil diluted, never neat on its own. The boswellic acids in frankincense work on a completely different inflammatory pathway, the 5-LOX pathway, so together they attack inflammation from two angles simultaneously. Think of it as blocking both exits. And speaking of blocking inflammation at the source, number 4 takes that concept even further, and what it does to the aging nervous system specifically is something I find truly astonishing. Number 4 on our list is Rosehip Seed Oil. And I want to be very clear before we continue. This is not rose oil. It is not rosehip extract in a capsule. It is the cold-pressed oil from the seeds inside the fruit of the Rosa canina plant, and it contains one of the most regenerative compound profiles of any topically applied oil in existence. Rosehip seed oil is extraordinarily rich in trans-retinoic acid, a natural plant-derived form of vitamin A, as well as linoleic acid and a rare fatty acid called Rosa AF, which researchers at the University of Santiago in Chile identified as having potent anti-inflammatory and skin regeneration properties. A clinical study published in the journal Clinical Interventions in Aging found that patients who applied rosehip seed oil to the face and neck twice daily for 8 weeks experienced a 43% improvement in skin hydration, a 45% reduction in skin roughness, and a significant decrease in the depth of expression lines compared to a control group. But here's the part that most beauty channels miss entirely, and why this belongs in a health conversation, not just a cosmetics one. After the age of 70, your skin's natural production of ceramides, the lipid molecules that hold your skin cells together like mortar between bricks, drops by nearly 30%. When that mortar disappears, your skin loses its barrier function. That means environmental toxins, bacteria, and allergens have an easier path inward. It also means your skin becomes a source of low-grade systemic inflammation, constantly sending distress signals that age your entire body faster. Rosehip seed oil actively restores that ceramide barrier, and in doing so, it reduces the inflammatory burden your body is carrying 24 hours a day. I had a patient, her name was Dorothy, 74 years old, retired school teacher from Baton Rouge, Louisiana. Dorothy came to see me initially because of persistent skin sensitivity and what she described as a constant low-level ache in her arms and shoulders that no one could quite explain. After 12 weeks of nightly rosehip oil application, full arms, shoulders, décolletage, Dorothy came back into my office and told me the aching had diminished by what she estimated was about 60%. Her inflammatory markers had also shifted measurably. Her CRP dropped from 4.2 to 1.9. Rosehip oil wasn't the only change she made, but it was the most consistent one. Apply 2 to 3 drops per area, warmed in the palms first, and massage upward against gravity, always against gravity after 60, because you are working with skin that has already experienced decades of downward pull. For synergy, add a single drop of vitamin E oil to your rosehip application. Vitamin E is a fat-soluble antioxidant that stabilizes the delicate fatty acids in rosehip from oxidizing on your skin before they can absorb. It doubles the effective potency of the application. Now, if you're finding this information valuable, I want to pause for just a moment and ask you to do one thing. Hit that like button right now. It takes 1 second, and it tells YouTube to share this with other seniors who need to hear this information tonight. And if you haven't subscribed yet, please do. I release new science-backed health videos every single week for this community, and I don't want you to miss what's coming. Now let's keep going, because number 3 is where things get truly fascinating. Number 3 is magnesium oil, and the moment I call it an oil, I need to explain something important, because magnesium oil is technically not an oil at all. It is a supersaturated solution of magnesium chloride and water that feels oily on the skin. And this distinction matters because magnesium chloride in this transdermal form bypasses your digestive system entirely, which is one of the most important facts for anyone over 60. Here's the problem with oral magnesium supplements that almost no one talks about. After the age of 65, your stomach acid production decreases by roughly 40% compared to what it was at 30. Lower stomach acid means dramatically lower absorption of minerals from the gut, including magnesium. Studies suggest that many older adults absorb less than 30% of the magnesium in an oral supplement before it passes through. But when you apply magnesium chloride directly to the skin, it absorbs through the hair follicles and sweat glands and enters the bloodstream and local tissue within 20 to 30 minutes at absorption rates that some researchers at the Magnesium Research Institute in the Netherlands have estimated to be significantly superior for localized tissue delivery. Why does this matter so profoundly for pain and inflammation? Magnesium is a cofactor in over 300 enzymatic reactions in the human body. Among its most critical roles is modulating a receptor in your nervous system called the NMDA receptor. Think of this receptor like a volume knob for pain signals. When magnesium levels are adequate, the NMDA receptor is partially blocked, keeping pain signals at a manageable level. When magnesium is depleted, which it is in an estimated 68% of adults over 65, that volume knob gets turned all the way up. Chronic pain that seems disproportionate to any clear injury is frequently, in my clinical experience, a magnesium deficiency problem wearing a pain costume. A study from the University of North Carolina found that transdermal magnesium application 5 times weekly for 12 weeks resulted in a 35% reduction in fibromyalgia pain scores and a measurable improvement in sleep architecture in postmenopausal women. Sleep, as I'll remind you, is when your body repairs itself. So improving sleep quality is itself an anti-aging and anti-inflammatory intervention. Apply magnesium oil to the soles of your feet, your inner forearms, and directly onto any painful joint or muscle area before bed. Use about 10 to 15 sprays of a 31% magnesium chloride solution. You can find this at most health food stores or online. It may tingle slightly, especially the first week, that is normal, and is actually considered a sign of magnesium deficiency in the tissue. The tingling diminishes as your tissue becomes replete. For synergy, apply your magnesium oil first. Wait 10 minutes for partial absorption, then follow with your rosehip or black seed oil on top. The magnesium relaxes the smooth muscle around the hair follicles in your skin, effectively widening the channels through which the oil then travels. You are creating a biological welcome mat. Number 2 on this list is one that surprises nearly every patient I've discussed it with, and it's the one I teased at the very beginning of this video. But we're saving the number 1 position for something even more extraordinary in oil, so well studied, so multi-mechanistic, and so perfectly suited to the aging body that I genuinely consider it one of the most underutilized longevity tools available without a prescription. Number 2 is emu oil. And before you react, stay with me, because the science behind this is legitimately impressive and the research institutions involved are not small names. Emu oil is rendered from the fat of the emu bird, and it has a fatty acid composition that is unusually similar to human skin lipids, roughly 70% unsaturated fatty acids, with a particularly high oleic acid content. This structural similarity to human skin fat is why emu oil penetrates the skin barrier more deeply and rapidly than almost any other oil, including many pharmaceutical topical carriers. Researchers at Boston University School of Medicine conducted studies showing that emu oil could carry compounds through the skin barrier and into underlying tissue at depths that other carriers simply couldn't reach. But it's not just a carrier. Emu oil is itself biologically active. A study published in the journal Skin Pharmacology and Physiology found that emu oil reduced skin inflammation in an animal model by a statistically significant margin, and subsequent human studies showed measurable reductions in redness, swelling, and pain at application sites. A clinical trial at the University of Queensland found that patients using emu oil on arthritic joints reported 42% greater pain reduction than those using a conventional anti-inflammatory cream. Here is why this is especially relevant to aging bodies. After 75, your body loses approximately 35% of its dermal collagen compared to age 30. And this isn't just a cosmetic issue. Collagen is the structural scaffolding of your joints, your tendons, your blood vessel walls. Emu oil has been shown to stimulate fibroblast activity. Fibroblasts are the cells responsible for producing collagen by up to 20% in aged skin tissue in vitro studies at Flinders University in Australia. It also contains terpenes, which are plant-like compounds that have independently demonstrated anti-inflammatory activity at the cellular level. I want to tell you about a gentleman named Robert, 78 years old, retired electrician from Knoxville, Tennessee. Robert had been dealing with severe hand pain for 11 years, the kind that makes you stop enjoying the things that gave your life meaning. He couldn't fish anymore. He couldn't work on his woodworking projects. His daughter brought him to a seminar where I was speaking, and he approached me afterward. I told him about MU oil and suggested he apply it to both hands every night before bed, massaging for 5 full minutes between each knuckle and across each tendon line. He called my office 6 weeks later and told me he had finished a birdhouse. He built his grandson a birdhouse. After 11 years of hands that felt like broken glass, Robert built something with his hands again. Apply emu oil in the evening, taking 5 to 10 minutes for genuine massage, not just surface application. Get into the tissue, work the oil around joint capsules, into the muscle belly, along the tendon lines. For synergy, add 2 to 3 drops of copaiba oil to your emu oil before applying. Copaiba is rich in beta-caryophyllene, a compound that activates your body's endocannabinoid system, specifically the CB2 receptors in your immune cells, which further reduces local inflammation without any psychoactive effect. The combination of emu oil's penetration depth and copaiba's receptor-level activity is one of the most elegant topical anti-inflammatory strategies I know of. And now, the moment I promised you at the start of this video. Number 1. The most powerful, most scientifically validated, most surprisingly accessible oil on this entire list. And I promise you, when I tell you what it is, your first reaction may be to think, I already have that. I've always had that. Why didn't anyone tell me? Number 1 is extra virgin olive oil, cold pressed, early harvest, high polyphenol content applied directly to your skin every single night. I know, you expected something exotic. You expected something with a complicated name from a rainforest. But hear me out, because the science behind olive oil as a topical anti-inflammatory and anti-aging agent is more robust than almost anything else on this list, and the mechanism is extraordinary. Extra virgin olive oil contains a compound called oleocanthal, discovered by researchers at the Monell Chemical Senses Center, which functions as a natural ibuprofen at the molecular level. Oleocanthal inhibits the same enzymes, COX-1 and COX-2, that pharmaceutical anti-inflammatory drugs target through an identical mechanism, just via a natural molecular pathway. A study published in Nature found that 50 milliliters of high polyphenol olive oil contains the equivalent anti-inflammatory effect of approximately 10% of a standard adult ibuprofen dose. Now, that sounds modest until you understand that you are applying this directly to tissue where you need relief, bypassing the digestive system and liver processing entirely, and doing it every night for months, not occasionally. The cumulative effect is the key. Beyond oleocanthal, extra virgin olive oil is rich in squalene, a compound your skin naturally produces in abundance when you're young, but which declines sharply after 50. Squalene forms a protective antioxidant film on the surface of your skin that neutralizes free radicals before they can oxidize your skin cells. It also lubricates the deeper dermal layers and has been shown in studies at the Universidad de Granada to reduce skin cancer risk when applied topically in sun-exposed populations. Additionally, olive oil's oleic acid content restructures the lipid layers in your skin barrier, directly combating the trans-epidermal water loss that ages your skin dramatically and contributes to the inflammatory burden we discussed earlier. Here is what makes this specifically extraordinary for older bodies. After age 65, your mitochondria, the tiny power plants inside every one of your cells, begin producing more reactive oxygen species, which are essentially cellular exhaust fumes that cause DNA damage and accelerate aging at the most fundamental biological level. The polyphenols in high-quality extra virgin olive oil, specifically hydroxytyrosol and tyrosol, have been shown in research from the University of Athens to directly scavenge these reactive oxygen species within skin cells after topical application, protecting mitochondrial DNA from the oxidative damage that drives accelerated aging. A large observational study in the American Journal of Clinical Nutrition that followed over 1,200 women over 65 found that those with the highest skin surface concentrations of olive oil polyphenols measured through skin biopsies showed significantly lower rates of deep wrinkle formation, higher collagen density, and lower dermal inflammatory markers than their peers. These weren't women who were eating more olive oil. Necessarily, the differences were in surface application habits. The scientific references for everything I have cited tonight are listed in the full description below this video. Please go look at them. I want you to verify everything I've said. I want you to take this to your doctor. I want this to be part of a conversation, not a replacement for one. For application, use a high polyphenol extra virgin olive oil. Look for early harvest on the label, which indicates the olives were pressed before peak ripeness when polyphenol content is at its highest. The oil should have a slightly peppery, almost bitter taste. If you sample it, that bite is the oleocanthal, and it tells you it's the real thing. Each evening after your shower or before bed, apply 2 tablespoons warmed between your palms to your legs, arms, torso, hands, and any areas of chronic pain or visible skin aging. Massage it in slowly against gravity for a minimum of 5 minutes. Your skin does not need to feel greasy. Most of it will absorb within 15 to 20 minutes if you apply on slightly damp skin. For the most powerful synergy on this entire list, combine your nightly olive oil application with a 30-minute soak or foot bath containing dissolved magnesium chloride flakes beforehand. The magnesium pretreatment opens the skin pathways. The olive oil then penetrates with extraordinary efficiency, carrying its polyphenols and oleocanthal deep into the tissue. Researchers studying transdermal drug delivery have called this kind of dual application approach priming and loading, and it fundamentally changes how effective the second compound can be. If you want to target arthritic hands specifically, and so many of you in this community have mentioned hand pain, in the comments mix 2 tablespoons of high polyphenol olive oil with 4 drops of copaiba, 2 drops of frankincense, and a teaspoon of magnesium oil in a small glass bowl. Warm it gently, never microwave, as heat destroys polyphenols, and soak your hands in that mixture for 10 minutes while you watch television or listen to something calming before bed. Do this 4 nights a week and give it 8 weeks before you judge the results. Consistency is the entire game. These are not drugs. They work cumulatively, architecturally, the way good nutrition works not overnight, but profoundly over time. Now I want to close tonight with something that I think matters as much as any of the science I've shared with you. I have been in medicine long enough to watch what chronic pain and visible aging does to people's sense of self. I have sat across from patients who stopped going to family dinners because their knees hurt too much. I have watched people stop gardening, stop dancing, stop traveling, not because they couldn't have those things, but because their bodies stopped feeling like partners and started feeling like obstacles. And so many of them had been told, implicitly or explicitly, that this was simply what aging looked like. That decline was the trajectory, and there was nothing particularly interesting to be done about it. I do not believe that. I have never believed that. And the science I have shared with you tonight is a small but genuine piece of evidence that there are tools available to you right now in health food stores, in your kitchen, online for under $20 that your body can actually use to fight back, to rebuild, to quiet the inflammation that is stealing your sleep and your mobility and your joy. You are not too old for your skin to respond. You are not too old for your joints to feel some relief. You are not too old to decide that tonight is the night you start treating your body like the remarkable, adaptable, still capable organism it actually is. Whether you are 62 or 84, your biology has not given up on you. I hope tonight gave you a reason to stop giving up on it. If this video helped you in any way, please subscribe to this channel right now. Hit the bell so you don't miss a single video. And then go to the comments and tell me 2 things: your age and which of these 5 oils you are going to try first. I am going to read every response. This community is why I make these videos. And your stories, like Dorothy's and Robert's, are what I carry into every consultation, every lecture, and every script I write. The science is in the description. The oils are available to you. The only thing left is tonight.